Dr. Jennifer Makarov. I'm here to talk to you about hysteroscopy today. So what is hysteroscopy and why do you need to do it? Okay, so hysteroscopy means putting a camera through the cervix into the uterus. So if this is the uterus here, the fallopian tubes. These are your fallopian tubes. And this is the uterine cavity here. And then there's little openings here to the fallopian tubes. So when you get your period every month, you're growing a lining, and then you're shedding this lining on the inside of your uterus. And some women sometimes develop overgrowth of the lining. There can be different issues inside the uterus that affect fertility. And once you've not been able to get pregnant, we want to take a closer look at the uterus itself. So one way to do this is to actually put a camera through the uterus. So let me show you how that looks here. So there's this type of camera. This is one we can do in the office. It's a flexible hysteroscope, and it's actually a little camera here. You can see here, and here's the screen, and this is a handheld device. So what happens is we put the hysteroscope through the cervix into the uterus, and you can look all around. You can see the opening to the fallopian tubes. You can see if there's any polyps or overgrowths in the lining of the uterus. Sometimes some women get little scars inside their uterus called synechiae. So we can actually see on the screen really clearly all around the uterus and identify any of these problems which interfere with fertility. Now this camera also, you can put a little instrument through. So sometimes we use a little instrument here, like this, which is a little grasper. So if we see a polyp or an overgrowth in the lining, we can use this little tiny grasper. You see it doesn't need to be very big, and it fits right through the camera here, like this. And then comes out the end. So as I'm looking at the camera, I can go in and just, if there's a little overgrowth, I can grasp that overgrowth and remove it through the cervix. So there's no incisions or anything. And then the little polyp is in the graspers here, and we send that off to pathology to confirm that it's a polyp. We can also take a biopsy of the lining of the uterus with this instrument and look for any inflammation or infection called endometritis, which can be treated with antibiotics. So it's a very useful tool and workup for women with infertility. Okay, thanks so much for joining me today.